Here I discuss about the interventional radiology and its different clinical applications. Let's start. Basic concepts. Interventional radiology or IR uses imaging guidance to perform minimally invasive procedure. So basically the interventional radiology is a invasive procedure of radiology which is which uses imaging guidance, usually fluoroscopy or ultrasound. The father of interventional radiology is Charles Dotter. IR procedures are commonly guided by fluoroscopy, ultrasound, CT, or MRI. The first angioplasty was performed in 1964. IR procedures usually require local anesthesia rather than general anesthesia. The main advantage of IR is less invasive treatment. IR reduces hospital stay and recovery time. Most vascular interventional radiology procedure use the Schlesinger technique. The Schlesinger technique was introduced by Sven Iyer Schlesinger. IR procedures are performed in an angiography suite. Imaging modalities. Fluoroscopy is the most common imaging guidance in IR. Digital subtraction angiography is widely used in vascular imaging. Digital subtraction angiography or DSA is the most common in interventional radiology. So this is widely used for vascular imaging. DSA removes background structure to visualize blood vessels clearly. Ultrasound guidance is commonly used for biopsy and drainage procedure. CT guidance is preferred for deep organ biopsies. When the mass is situated in the deepest part of the organ, then CT guided biopsy is preferred for proper guidance. MRI guided interventions are less common due to technical limitation. MRI is very sensitive to ferromagnetic substances. That's why MRI guided interventions are less common due to technical limitation. Flat panel detectors are used in modern angiography system. Road mapping technique helps guide catheter movement in vessels. Contrast media is essential in most angiographic procedures. Iodinated contrast agents are commonly used in angiography. Catheters and guidewires are used in digital subtraction angiography to insert and navigate through the blood vessels. Catheters are flexible tubes used to access blood vessels. Guide wires help guide the catheter into vessels. The most common arterial access site is femoral artery. Radial artery access is becoming increasingly common. Introducer sheath allows repeated catheter insertion. Microcatheters are used for super-selective catheterization. Hydrophilic guide wire reduce friction during navigation. Catheter size is measured in French or F unit. 1 French equals to 0.33 mm diameter. Pictal catheter is commonly used in aortography. Next point, angiography. Angiography is imaging of blood vessels using contrast media. Arteriography is studies of arteries. Venography is studies of veins. Coronary angiography visualizes coronary arteries, which supplies the muscles of heart. Cerebral angiography studies brain vessels. Pulmonary angiography evaluates pulmonary embolism. Renal angiography evaluates renal artery stenosis. Peripheral angiography evaluates limb circulation. Angiography requires iodinated contrast injection. DSA improves vascular visibility by subtracting bone structure. And We can see the blood vessels without any superimposition. Next, angioplasty and stenting. Angioplasty is the widening of narrowed vessels using a balloon catheters. A balloon catheter is inflated at the stenotic segment. Stents are metallic mesh tubes used to keep vessels open. Balloon expandable stents requires balloon inflation for deployment. Self-expanding stents expand automatically. Drug-eluting stent release medication to prevent restenosis. Angioplasty is most commonly used in peripheral artery disease. Renal artery angiography treats renal artery stenosis. Carotid artery stenting treats carotid stenosis. Coronary angioplasty is also called PCI or percutaneous coronary interventions. Embolization, next point. Embolization is the intentional blockage of blood vessels. So, embolization is the intentional blockage of blood vessels. It is used to stop bleeding or cut blood supply to tumors. Embolization agent includes coils, particles, and glue. Coil embolization is commonly used in aneurysm. Gel foam is a temporary embolic agent. Polyvinyl alcohol particles are permanent embolic agent. Embolization can treat uterine fibroid. Uterine artery embolization reduces fibroid blood supply. Tumor embolization reduces tumor vascularity. Embolization can control traumatic bleeding. Next point, biopsy and drainage. Image guided biopsy allows tissue sampling from organs. Ultrasound guided biopsy is common for liver lesions. CT guided biopsy is common for lung lesion. Fine needle aspiration cytology, also called FNAC, uses thin needles. Core biopsy uses larger needles for tissue samples. Abscess drainage is commonly performed under ultrasound or CT guidance. Percutaneous nephrostomy drains urine from kidney obstruction. Biliary drainage relieves bile duct obstruction. Cholecystectomy drains gallbladder infection. Drainage catheters are left in place for fluid removal. Next, tumor treatment. Interventional radiology also used in treatment of tumor. Radiofrequency ablation RFA, a part of interventional radiology procedure which restores tumor using heat. Microwave ablation also uses thermal energy. Cryoablation destroys tissue by freezing. Transarterial chemoembolism or TSE treats liver cancer. TSE or TES combines chemotherapy with embolization. Y19 radioembolization treats liver tumors. Percutaneous ablation is commonly used for small tumors. Interventional radiology plays an important role in cancer therapy. Ablation procedures are guided by CT or ultrasound. Tumor embolization reduces tumor blood flow. Emergency interventions. IR can control internal bleeding rapidly. For trauma patient, it may require to embolize the artery called arterial embolization. GI bleeding can be treated with angiographic embolization. Pulmonary embolism can be treated with catheter directed thrombolysis. Thrombectomy removes blood clot from vessels. Stroke treatment may involve mechanical thrombectomy. Endovascular therapy is used in acute ischemic stroke. Aortic aneurysm can be treated with EVAR or EVAR, endovascular aneurysm repair. Endovascular repair is less invasive than open surgery. Interventional radiology plays a vital role in emergency medicine. Next, radiation protection. Fluoroscopy exposes staff to scatter radiation. Lead apron reduces radiation exposure. Thyroid seal with lead apron should be used to protect the thyroid gland. Lead glasses protect eye lenses. Ceiling mounted shields reduces scatter exposure. Here we have to mention that the lead apron of the interventional radiology should be 0.5 mm lead equivalent. Time distance shielding are key radiation protection principle. Pulse fluoroscopy reduces radiation dose. Collimation reduces exposed field size. Proper position reduces radiation exposure. Radiation monitoring uses dosimeters. For interventional radiology or interventional radiologist or staffs, the TLD batch usually used in reduced equipment and suite. Angiography suites use C-arm fluoroscopy system. Modern system use flat panel detectors. High frame rate are needed for vascular imaging. Contrast injector provide control contrast delivery. Pressure injectors are used in angiography procedures. IR suites require sterile condition. Sterile drapes used during procedures. Local anesthetic is commonly lidocaine. Sedation may be used for patient comfort. Continuous monitoring of vital signs is essential. Next point, complication. Bleeding is a possible complication of IR procedures. Infection may occur at the puncture site. Contrast reaction may occur with iodinated contrast. Contrast-induced nephropathy affect kidney function. Vessel injury may occur during catheter insertion. Hematoma may form at the access site. Pseudoaneurysm can occur after arterial puncture. AR embolism is a rare complication. Radiation exposure is a risk in long procedures. Proper technique reduces complication risk. Next point, clinical applications. Interventional radiology is widely used in vascular diseases. It plays a key role in oncology treatment. IR helps manage chronic pain treatment or condition. Vertebroplasty treats vertebral compression fracture. Kyphoplasty restores the vertebral height. Dialysis patient require vascular access intervention. IR can treat varicose vein. The procedure is used to treat varicose vein is sclerotherapy. Endovenous laser therapy treats venous insufficiency. IR is used in organ transplant procedure. It is increasingly replacing open surgical procedure. Future of interventional radiology. Robotics may assist catheter navigation in future interventional radiology. Artificial intelligence may help image guidance. Fusion imaging combines CT or MRI with fluoroscopy. Navigation system improve procedure accuracy. 3D angiography improves vascular visualization. Cone beam CT is used in angiography suites. Image guided therapy is expanding rapidly. Interventional radiology is one of the fastest growing radiology subspecialties. Minimally invasive procedures are becoming preferred treatment. IR reduces patient morbidity and mortality. Quick revision facts. Most interventional radiology procedures use percutaneous access. The femoral artery is the traditional Access site. Radial access reduces bleeding and complication. Guide wires are essential for vascular navigation. Contrast media is crucial for angiographic visualization. Embolization is used to stop bleeding or treat tumor. Ablation destroys tumor tissue locally. Fluoroscopy is main imaging modality in IR. Interventional radiology procedures are usually minimally invasive. Interventional radiology combines diagnosis and treatment in one procedure. Thanks for watching.